Hello, everyone. My name is Jen Braun, and I direct the AHA Team Training Program. Welcome to our February webinar on building stronger teams through various TeamSTEPPS approaches. So this webinar is meant to really give you a snapshot of 3 different institutions and their approaches to TeamSTEPPS training, implementation, and sustainment. And so all 3 are in a different phase of their journey. And so they'll go one at a time and present their story in an SBAR-style format. And then once all 3 have gone, you'll get to ask some questions at the end. So this is really your time to get into the nuts and bolts of how TeamSTEPPS is done. And so I'll introduce our speakers here in a moment, but I'm going to go over a few rules of engagement first. I'm sure this is not everyone's first rodeo on Zoom, but you can access audio by listening in through your computer speakers or through your phone. If you're having any issues, you should be able to access the toolbar at the bottom to switch to either phone audio or computer audio. Please note that you're in a listen-only mode, and I will moderate a Q&A session at the end with our speakers. So if you have a question, please chat them in throughout as you think of them. If it's technical or logistical, we'll try to answer it in real time, but if it's for our speakers, we'll save it for the end. And as always, we're happy to offer free CEs for our webinars. And so in order to claim your CE credit, you have to create a Duke OneLink account. Duke is our CE provider. And so this is a one-time only setup, and Kara will be chatting in those instructions, and you can also refer to the email that was sent to you this morning that includes the instructions there as well. And so following the webinar today, we're going to have you text the code you see there, FECCEG, to the number on the screen. And so we'll share this at the end, so don't worry if you didn't catch it right now. A few announcements for upcoming events. Registration for our 2-day master training courses for the first half of the year are open. If you're interested in registering for one, please note that we really encourage teams to attend, and we have a team discount. So you can visit our website to learn more. In addition to our in-person courses, we have registration open for our virtual cohort that kicks off in mid-April. And I want to call out that we will be offering a master trainer info session coming mid-March. More details will be shared soon, but this is an opportunity to hear directly from master trainers themselves about tips for choosing master trainers, their role following a course, and really best practices leading up to attending a 2-day master training course. So if you're all interested in a master training course, this will be a really good session to get your questions answered and provide a little bit of coaching prior to your training and implementation. In terms of webinars, our March 13th webinar will focus on how to action plan your TeamSTEPPS implementation. So it will be a bit more of a hands-on webinar experience, and registration's now open for that. And then finally, we have a new offering that is also complimentary. We're hosting a 90-minute virtual workshop on March 14th on leading well from within, a neuroscience-based approach to leadership in high-pressure, high-stakes environment. Dr. Dan Diamond is leading that, and because this is a really interactive learning experience, live attendance is a must, and there's limited capacity. I checked this morning, and there's not many seats left. So if you're interested, Kara can chat in the link, and you can learn more about that. And finally, if your organization is interested in a custom TeamSTEPPS training on site, we have what we call our TeamSTEPPS advisory services. And so this is where we work one-on-one to provide you a customized master training course or a more comprehensive TeamSTEPPS program. If you're interested, you can learn more and sign up for a one-on-one info session with our team training clinical program lead, who can share a bit more information about that. So with that, I'd like to briefly introduce our panelists today. You'll each get to hear from them, and they'll share more about themselves and their organizations. But first up is Angie Black, who's the Vice President of Operations at Northwestern Central DuPage here in the Chicago suburbs. Following Angie is Denise Mazzapica, who is the Manager of Nursing Initiatives at Northwell Health in New York, where they're also one of our regional training centers and provide those 2-day master training courses. And then finally, we have Kathy Heelick, who is the Assistant Vice President of Patient Safety at Inova Health System in Virginia. And so before I hand this off to our first speaker, I'd like to share today's objectives. So today our speakers will share the effectiveness of the various approaches to TeamSTEPPS implementation and describe the impact it's had on either patient safety, patient experience, or workforce engagement. And then finally, they'll share some methods on what they've done to embed TeamSTEPPS into their cultures. So really excited. We have a group of fantastic women to present today. So I'm going to kick things over to Angie.
Thank you so much, Jen. Hello, my name is Angie Black, and as Jen said, I'm one of the vice presidents at Northwestern Medicine Central DuPage Hospital. My clinical background is pediatrics, PICU, and pediatric emergency nursing. I currently work with our Women's and Children's Division, Emergency Department, Respiratory Care, Spiritual Care, and our hospital outpatient teams. We move to the next slide. So through our clinical case reviews, employee engagement surveys, our culture of safety surveys, we began to see some common themes within our Women's and Children's Division, highlighting opportunities for improvement surrounding teamwork and communication. More specifically, the themes were related to perceptions of a lack of clarity of roles and responsibilities, breakdowns in communication, some ineffective teamwork at times, lack of situational awareness or feelings of mutual support and respect, and some hesitancy to speak up when they felt the need to. Next slide. So a little bit of background. Our organization is a 406-bed acute care hospital, and we are part of an 11-hospital health system here in the suburbs of Chicago. We are also a level 3 perinatal hospital caring for high-risk obstetric and neonatal patients with about 2,700 deliveries a year. We are also a comprehensive stroke center and a level 2 trauma center. We are a magnet hospital and we're seeking our 4-3 designation. And our visit's actually coming up in just a few short weeks. We have had a comprehensive safety program in place since 2013, which included implementing and enculturating 11 safety tools to improve the quality of care and decrease our serious harm events within our organization. This has been incredibly successful in our journey to become a high reliability organization. That said, we do continue to strive to be better and identify opportunities for improvement. On the right of the screen, you'll see our patient safety model, which is shown, and it highlights our 4 key concepts of prevention, response, improvement, and measurement, with our North Star and our hospital mission of patients first in the center of all that we do. Next slide. So this slide shows the 11 tools that I had mentioned on the previous slide, and some will look a little bit familiar if you have gone through TeamSTEPPS, which is one of the reasons why we are so drawn to it. So our safety tools that we use here are peer coaching, clarifying questions, SBAR, 3-way repeat and read back, safe and effective handoffs, numeric clarification, reporting of safety concerns, STAR, question and confirm, ARC, and cross-check and assist. And on the right side of the screen is just an example of one of our safety tools, that's STAR. Each month we highlight a safety tool in our huddles, our staff meetings, and our leader rounding to influence. And this is also part of our onboarding for every employee and our culture of safety. Next slide. So as we identified the themes around roles and responsibilities, communication, and teamwork, we decided to look for an additional evidence-based tool to enhance safety through improved teamwork and communication and mutual support. We met with several individuals who had implemented TeamSTEPPS and felt that this program really best met our needs. We also decided to administer the Teamwork Attitudes Questionnaire to assess our team's attitudes towards those core concepts of TeamSTEPPS. And this really helped us assess not only where we had training needs, but also the readiness and openness of our team to work on teamwork and communication. And what we found is our team was not only ready, but had a really strong desire to learn more about these tools and implement something that could help build on our culture of safety and specifically improve the team dynamics within Women's and Children's. So we decided to start with our obstetrics department. Next slide. So timing happened to be just right for us. We had the opportunity to apply for a patient safety grant, and we were awarded $50,000. We were able to use these funds to host a TeamSTEPPS master training course. We had 45 employees and physicians from our organization attend. Although the focus was in our OB department, we did invite members from other key teams that could benefit from the course. Some examples are our quality and safety department, our ICUs, EDs, pediatrics, OR, all joined us for this 2-day course. And we had 2 fantastic trainers from the AHA, Jen, who is facilitating this, and Ross. And they really set the stage with our team, and everybody walked away from this 2-day course excited and reinvigorated around safety. From there, we created change teams within our OB department and identified what our focus would be for TeamSTEPPS implementation. We designed a 3-hour curriculum. With our grant funding, we were able to pay all of our employees and physicians who attended, separate from our unit operating budgets. So this was really helpful when we're faced with looking at productivity and expenses. It helped offshoot that, and our results really were able to help expedite us spreading this through the hospital. The main focus was on implementation of briefs, huddles, and debriefs, along with other key communication, teamwork, and leadership TeamSTEPPS tools. Checklists and processes were created to accompany and support this implementation. Our change team was instrumental in creating the curriculum and new processes, while also being our unit champions and cheerleaders and consistently role modeling these tools that we were wanting to hardwire. We administered the teamwork perceptions questionnaire immediately before our 3-hour training course using a QR code via Microsoft Teams. And I will say I kept contacting Jen as we were going through this to say, is that okay that we put it in an electronic format? And the flexibility with this program has just been amazing. So that was very helpful. Next slide. So we did invest a lot of time in preparing for these 3-hour training courses. We began by planning immediately following our master training because we wanted to make sure it was fresh. And we had access to the amazing resources from the AHA. We used many of their slides, videos, and activities while customizing to our organization and specifically our OB department. We had at least 2 to 3 master trainers presenting the content and at least 1 person in the role of organizer to make sure we were staying on time, registration went smoothly, the setup of the room and the activities just flowed really nicely by having that person in that role. We hosted a debrief after each session, and we were able to incorporate our learnings into the next class that we taught. And we also documented all of our lessons learned throughout this whole course so that we could pass them along to the next department or hospital within our system that would like to implement TeamSTEPPS. Next slide. Part of our planning included making sure each session was multidisciplinary. That was really important to us. And we even had seating assignments to make sure the tables were representative of our entire team, which included nurses, our health unit coordinators, scrub techs, obstetricians, and anesthesiologists. Our team created videos to highlight what a brief, huddle, and debrief would look like in our OB department. We also introduced new checklists during this time. We found that the Lego activity that the AHA provided were really a huge hit. Everybody loved it, got really engaged, and everybody was very competitive around the Jeopardy game. A TeamSTEPPS pocket guide was printed and handed off to each of our participants, and then we also have them available on the unit in case people don't have it with them. Next slide. So as I mentioned, we administered the teamwork perceptions questionnaire at the beginning of each of the courses, and then we re-administered 12 weeks after the training and implemented the briefs, huddles, and debriefs. And we found that our results in teamwork, situational awareness, mutual support, and communication improved with more agree and strongly agree responses. The team continues to hold these briefs, huddles, and debriefs, and these concepts are being incorporated into our ongoing simulation events. So over the next 6 months, we'll be doing hemorrhage and hypertension simulation events, and it includes the briefs, huddles, and debriefs that we've learned. We've also heard from the team that they feel an improvement in collaboration, teamwork, and mutual respect has been a result of this as well. Next slide. So some strategies that aided in our success include taking the time to crosswalk our current safety tools with the TeamSTEPPS tools. We found that TeamSTEPPS really aligned nicely with our culture of safety and helped us move from an individual focus to a team focus. We also spent a good amount of time preparing and incorporating change management techniques for the implementation by creating a work plan. We individualize the activities and content to be more specific and relevant to our practice area. We created our own scenarios, scripts, and videos for the SBAR, brief, huddle, and debrief. We also chose which TeamSTEPPS tools and content to use in response to the specific concerns within the department we were working with. And knowing we only had 3 hours of training time, our change team was instrumental in creating the curriculum and executing on the units. I will say the AHA content, videos, and activities were incredibly well received and helpful for us as the planners. And putting the teamwork perceptions questionnaire in an electronic format made it much easier for administration of the questionnaire and then later for our analysis. So I'd highly recommend that. And then my last slide. I'm happy to share we're now implementing TeamSTEPPS in our critical care units. We started this week actually on Monday with our 1-hour multidisciplinary training session. And the focus will also be on brief, huddle, and debrief. We've included the components of a shared mental model and key communication tools such as SBAR, the 2-challenge rule, and CUS. This content was based on feedback from their leadership team, the physicians, focus groups with the staff, and their employee engagement results. We are also doing a quality improvement project looking at the impact TeamSTEPPS has on burnout and compassion satisfaction, using the ProQual scale for pre and post measurement. I found, this is actually part of my DMP project, and I found in the literature there's more and more evidence that implementation of TeamSTEPPS in critical care settings or other settings like ERs and high emergency situation settings has an improved teamwork attitudes and performance, and that leads to decreased feelings of burnout and improved patient outcomes. So we're really excited to see the results from this pre and post data related to burnout. So thank you for allowing me to share our TeamSTEPPS journey here at CDH in our OB department. I'd be happy to take any questions at the end of the presentation, and I will hand off to Denise. Thank you.
Thank you, Angie. Hello, everyone. I am Denise Mazzapica. I am one of the managers and educators here at Northwell Health. I work for the chief nurse exec of the health system at the Institute for Nursing. And I'm going to share with you, we've had a long journey with TeamSTEPPS and team training. We started in 2007, and I'm going to share with you how we roll this out, beginning with one hospital at a time. So I'm going to share that one hospital journey with all of you. So back in 2007, even though we had multiple safety initiatives going on across the health system, when we reviewed incidents that impacted patient outcomes, we discovered that we had an opportunity in the areas of communication failure and ineffective teamwork. And so the leadership of the organization decided that, you know, there was a lot of literature and research at the time that showed that team training had a real impact. It was a strategy to enhance teamwork and to reduce errors. And so the decision was made that we were going to use and select TeamSTEPPS, which had been developed by AHRQ in the Department of Defense to create a culture of safety. We wanted to use it to make a transformational change in our organization to a culture of safety. And we decided that in order to be able to really do this and make it stick, we needed to incorporate TeamSTEPPS into our organizational matrix, into our professional practice model. And here on the right, you see what was our professional practice model. And you'll see it says North Shore LIJ because that's what we were called back then, North Shore LIJ. And we wanted to use TeamSTEPPS to help operationalize our values. And the values we were looking at were collaboration, leadership, and safety. And here at Northwell, we really focus on the Donabedian model when we want to make change and have outcomes. So we always want to have a structure, a process, which will lead us to the outcomes. So before we actually decided on what hospital we were going to start with, at the corporate level, a team was formed. And this was a team that had experience in research, evidence-based practice, education, and management. And this team was formed to help facilitate the implementation of TeamSTEPPS, ultimately across the entire organization, but beginning with a pilot hospital. We can move on. So let me tell you a little bit about Northwell Health. This is us today. We are the largest private employer and healthcare provider in the state of New York. We have 21 hospitals as part of our organization and over 900 outpatient facilities. We currently have approximately 19,000 nurses employed across the organization, and we have 5,400 employed physicians and approximately 4,500 members of our Northwell Health physician partners. These are the private practices. And we also have, no problem, we also have our own medical school, and we have a nursing school at both the undergraduate and graduate levels. Moving, next slide. So let me tell you a little bit about how we did this. Before we even went to the pilot hospital was actually a volunteer. One of our community hospitals volunteered to be the first hospital to trial the TeamSTEPPS. And before we even went to the pilot hospital, the corporate team, along with corporate leadership, just sat down and planned. Okay, what did we want to do? And one of the first things we decided on was we needed to have an infrastructure for change. And if you know anything about, if you know TeamSTEPPS, you know they talk about their a change team. And we decided that we were going to take that change team and we were going to make it permanent. We were going to create a unit or department level change team. We decided to call it a collaborative care council to go along with our collaborative care model. And we also had an executive sponsor team. And that was, of course, all of the members of the C-suite at the hospital level. So this was going to be on our infrastructure. We would have a hospital level team as well as a unit-based team. The unit-based team would include all of the disciplines that worked on the units at the hospital. They would all be brought in very early on in order to become part of the change process at an early stage. We also looked at how are we going to do this training? And we decided that we were going to start with a train the trainer model, which was our 2-day master training course. And we also had a teach back, which was a session that we would schedule post-training, give everyone a chance to absorb the training. And then we would schedule those people who were going to be master trainers to come back and do a teach back with the corporate level team. At the site level, the decision was made that they would do the 4-hour fundamentals training for the clinical staff and the 2-hour essentials training for the non-clinical staff. We also decided that the training needed to be interdisciplinary. Now you have to understand, here at Northwell, we had physicians and providers that were employed by the hospital, and those physicians and providers we were able to put into interdisciplinary classes with the other disciplines on the unit and in the hospital. The attendings and the voluntary staff, we had to become a little bit more creative with them. And what we did was we would train them in dinner meetings. We would go to their ran rounds that they would hold on a monthly or bi-monthly basis and do training there, even if we had to come back multiple times. We also engaged physician champions that went through master training and also trained with us. Next slide. And this is how we implemented. We actually used the TeamSTEPPS implementation plan because it was a standardized process. First phase was preparation and assessment. We would go to the site. We went to the pilot hospital. We met with the executive leadership. We gave them an overview of TeamSTEPPS. We assessed whether or not they had any other competing objectives or initiatives going on. And then once they decided that no, they were ready to go, we sat down and created a plan. How are we going to implement? Which service lines would we go to? Would we start in the ED and then go to med-surg? What is it that they wanted to do? We then sat down and created a timeline for training. Where were we going to roll out? What was the time frame? How are we going to do it? At each site, starting with the pilot site, every member of the leadership team and the executive team trained. They all went through master training so that they were there also to support this training and rollout as it was going forward. We picked a pilot unit in the pilot hospital, all right? And we then started in that unit. Once we completed training, we started implementation very quickly. That was one of the plans, that you would minimize the time between training and rollout. Once 60% of the staff was trained, we began the implementation of the tools. And we also started with briefs, huddles, and debriefs. Next slide. Now, I want to tell you a little bit about the results at the pilot hospital. When we did the AHRQ hospital survey on patient safety culture prior to initiating training, all right? That was one of the first things we did. In 2007 at the pilot hospital, they were below the national benchmark in 9 out of 12 domains. In 2013, we completed the rollout at the pilot hospital in 2008. When we did the survey in 2013, they were above the benchmark in 11 out of 12 domains. And up to recently in 2022, when this pilot hospital took the culture of safety survey, they were above national benchmarks in all domains. So they not only created a culture of safety at their hospital, but they have sustained it over the years. In 2023, we are happy to tell you, and now going into 2024, that we call TeamSTEPPS being routinized. It's part of our DNA. It's part of what we do. It's how we operate and how we do business. And some of the recommendations that I would give to you going forward would be, make sure you have that permanent structure for change and sustainment. We call them collaborative care councils. Some hospitals call them unit councils. You want to make sure you have a standardized implementation process, whether you use the TeamSTEPPS plan or you create another one. But that helps you to make sure that you're doing it in a precisely the same manner. You want to make sure that you train everyone, including your leadership and managers, so that they can also be coaches for the staff once you roll it out. Training should be interprofessional. You need to make sure you're including those providers. And if you don't, the other team members will point it out, where are the providers. And in order to sustain, you've got to anchor TeamSTEPPS in every aspect of the organization. We have it in orientation for new employees. We put it in all of our policies where applicable. It's used in all of our simulation workshops, and it really has become part of our DNA. Next slide. And with that, I am happy to hand it over to my colleague, Kathy.
Thank you so much, Denise, and to Angie as well. I appreciated the opportunity to hear your stories. Good afternoon, everyone. I'm Kathy Helak from Inova Health System, and I'm so pleased to share the work that we've been doing over the last several years at Inova. This has really been an evolving journey for us in order to support our organization's strategic priorities. And we really have seen a very positive impact of using TeamSTEPPS and, as Denise said, integrating it into our DNA. through our safety culture. So let's move on and talk a little bit about our situation. So for ANOVA, TeamSTEPPS has really been instrumental in creating what we call a one-team mindset, because we know that in order to deliver world-class care to our patients, we need to have a healthy work environment. And so we've made a strong investment in social capital. And what I mean by that is really assuring that we have an environment that's fearless, that's psychologically safe, that our team members trust, that is inclusive and really encourages open communication and a consistent practice of our safety behaviors and use of our error prevention tools to keep our patients safe and to be able to deliver that world-class care. So as we think about who ANOVA is, we have a very strong mission, vision, and values, and a strategic priority that we call our care mandate. And that care mandate really is our strategy for excellence to provide people-centered, high reliability, high value, seamless system of care to all of the people that we have the privilege to serve. And we do that through these 5 care imperatives. This is our how to deliver excellence to our patients. And I would just highlight that there are a couple of critical elements in our care imperatives that our TeamSTEPPS journey has helped us to support. First is creating an environment of zero harm. Second is creating a culture of psychological safety. And third is really, we must collaborate in teams. And so that supports the fact that one of our most important values is taking care of our people and creating that one team mindset. So a little bit more just about ANOVA Healthcare System. We are an integrated care delivery system, and we have received many external accolades, recognitions, and designations for clinical excellence. Our hospitals are all designated with magnet designation. We have received consecutively several safety A scores from Leapfrog, and we are rated as a 5-star CMS system for all of our hospitals. These ratings and designations are really the result of over 22,000 team members working in our 5 acute care hospitals and hundreds of ambulatory care settings in the Northern Virginia Metro DC area, all within the Beltway. So let me give you a little bit of background about how this journey has evolved over time. So back in 2014, there were pockets of interest in team training across our organization. But what was noted was it was varied. Interest varied, the type of team training varied. That led to differences in the curriculum, differences in who was training, and really unclear expectations and intentions in terms of what we hope to get from team training. We also saw in our safety results at that time that there were significant opportunities to improve communication, creating that shared mental model, creating an environment where our team members felt safe to speak up, particularly in high-risk situations such as a postpartum hemorrhage or a critical care situation or in the OR. And so we had 2 pivotal moments in our journey that have really led to the success that we have today that I'm excited to share with you. The first was in 2018 when we had the opportunity to see some leadership changes, and we have been really blessed with our CEO who joined us in 2018, Dr. Stephen Jones, and he began to create the journey to excellence and the cultural transformation around systemness. That led to our care mandate, which I just shared with you, and those 5 care imperatives and how we are going to deliver world-class care to the people that we serve here in Northern Virginia. With that came the opportunity for us to build stronger will and commitment to standardizing team training as part of our values and those care imperatives. So that gave us some traction, and that traction allowed us to expand across all of our hospitals where we were providing team training. We were doing it at that point in person and using some of the tools that Angie shared earlier. It was fun, it was engaging. We had multiple disciplines participating in those classes. And then in 2020 came COVID. And it was a real significant tipping point for us because we were excited about the traction that we were making in terms of spreading TeamSTEPPS more across our organization. However, with the pandemic, we needed to pause, as all of us did, because of the impact on our hospital systems in terms of working closely together. Teamwork, we knew during COVID was essential, and we knew that we had to continue to keep the momentum going. So in pausing, we stepped back and said, how do we keep team training going given the pandemic? And so we moved to a virtual training program that created a lot of efficiencies and, quite frankly, initially a little bit of angst and concern because we were losing that ability to have that in-person fun and in-person connection. But we got very creative and we decided we're going to give it a go because it was so important for us to continue to maintain team training as part of our commitment and investment to our team members. At that same time, we implemented system tiered huddles. And while we've all had huddles in place, I'm going to share with you one of the things that we've done that's really built on the importance of teamwork across our very large healthcare system. That's led us to where we are today. And what I'm going to share with you is how we've moved to a mandatory onboarding TeamSTEPPS program for every new team member that joins Inova Health System. Whether you are a frontline team member, a contract team member, a provider, it is a mandatory requirement that you complete TeamSTEPPS fundamentals as part of your orientation and introduction to Inova Health System. We also have built in the opportunity for refreshers. And one of the things that we did with our last safety culture survey, which was in March of 2023, was identify an opportunity just to make sure that our leadership was continuing to maintain and role model the way in terms of our TeamSTEPPS tools and our focus on psychological safety. And so we did mandatory leader refresher TeamSTEPPS training in 2023 across our entire health system to assure that we were continuing that line of sight about how important this program is. Let's move on and talk a little bit more now about what did that look like. So we had 3 objectives with our TeamSTEPPS training. The first is we wanted to make sure that it continued to be a standardized training curriculum. Here at Inova, I have the privilege to work with an incredible group of patient safety managers across our health system. And all of our patient safety managers are master TeamSTEPPS trainers. So we require that of our patient safety team, and they serve as the faculty for all of the TeamSTEPPS training goes on across our organization. That has allowed us to make sure that we are using all the tools from the AHA toolkit, and we are also bringing in those important points around our safety culture. What we expect of team members as they join our team and what they can expect in terms of our commitment to them as a new member of our team. It's also a way for us to highlight what they hopefully are already experiencing as they're onboarding in terms of their daily huddles, the use of SBAR, the ability to speak up and use cuss and so forth. And we have found that the virtual approach has really been very efficient and well received by team members across our entire system in terms of making it easy to access it during their onboarding program. We also created expectations. And so in addition to onboarding, we have certain programs that require that there's evidence that the TeamSTEPPS training has been completed. So for example, through our clinical ladders and other advancement programs, team members who are going through the steps for those different programs have to show evidence that they have completed a recent TeamSTEPPS training program. All of our safety coaches are TeamSTEPPS trained so that they, again, can role model the way. So even though they may have had it in onboarding a few years ago, we want to make sure that they're all up to speed on that. I mentioned that we have recently done a leadership refresher, and we do periodic refreshers, especially in some of our high-risk areas, as Angie mentioned earlier, to make sure that we keep that line of sight of how important good communication and teamwork is to the success of our patient outcomes, as well as creating that healthy work environment for our team members to thrive in. And then finally, how do we adopt and make TeamSTEPPS visible, not only in our day-to-day communication with each other, but how do you weave it into other parts of your organization to make sure that it's truly visible? And so I'll show you a couple of examples of things that we have done at ANOVA, and I hope these are helpful to you. Now, when we talk about huddles, we all know how important huddles are to our organizations. They are important in terms of creating that shared mental model, creating situational awareness, mutual support to each other, certainly creating a safe space for team members to speak up. Psychological safety is so important, and then assisting each other. What we did at ANOVA back in 2020, and it's become one of the most important moments of our day, is we added an additional tier to our tiered process, and that is our system leader safety briefing. And I'm proud to share that our tiered huddle process is a 365-day-a-year process. So our system leader safety briefing is our most executive level of the organization. It includes our system CEO, all of our most senior executives who come together every day, 7 days a week, to make sure that we have situational awareness of what's going on across our organization, both in terms of safety concerns and safety risks that we want to mitigate proactively as quickly as possible with a sense of urgency so that we are addressing our frontline team members' concerns. Because we all know that a tiered huddle process is an escalation of safety concerns from the front line. So we want to be there to act on those as quickly as possible. Another example of what we've done is we have embedded a lot of the TeamSTEPPS tools into our patient safety webpage. And this just shows you on our intranet, we do have a specific patient safety page. And we have a link, if you go into teamwork and collaboration, it pulls up all of these different tools that are easily accessible to our team members and to our leaders if they're looking for job aids and resources that can help them in the moment if they're working on a particular safety issue with their department. We have the TeamSTEPPS Pocket Guide there. We also have the TeamSTEPPS Fundamental Schedule for all of our classes that are offered twice a month, and they're 90 minutes long. Another thing that we have done is that we have embedded a focus on TeamSTEPPS and high reliability into all of our event management work. And so what you see here on the slide is the SBAR or the TeamSTEPPS tool list that helps us as we are evaluating a safety event. Where did we have an opportunity? What could we do differently around our handoff process? Or do we need to create more psychological safety in terms of speaking up? So we use this guide as well as our principles of high reliability in every event review to make sure that we are paying attention to these important principles for the improvement of safety to our patients and to our team. And then the next slide will show you some of the results that we have been able to see over the course of time as a result of our work with TeamSTEPPS. So what you see here is year-over-year improvement in our hospital safety culture survey results. This is the overall metric, which is called the overall percent positive response, or OPPR, and it shows you that we have continued to improve year over year, particularly between 2019 and 2021, when we really went to that mandatory onboarding method and went to a virtual platform. And you can see that we continue to excel beyond what the national benchmarks are. And then finally, I'll share that this is our safety culture survey results, both for 2021, which I'll just point out, which was in the midst of the pandemic, and in 2023. So we have continued to see consistent strength in our safety culture around reporting, learning, communicating about errors, and management support. And we know that having a strong safety culture is based on creating that strong teamwork and a psychologically safe space for our team members to thrive in. We believe that if we take care of our people and we truly have a one-team mindset, we will deliver world-class care to our patients and achieve those great outcomes that we all are striving for in all of our organizations. So my recommendations and some takeaways for each of you are just to think about how important team training is to your mission and to what you are desiring to accomplish for the patients that you have the privilege to serve. I would encourage you to think about how do you gradually evolve to embed TeamSTEPPS across your entire organization and weave it into your daily work, as well as all of those opportunities to make it very, very visible for all team members to access every day when they're at work. So with that, I'm going to close and turn it back over to our hosts and open it up for questions.
Thank you all so much. I appreciate your stories and sharing some of your successes and lessons learned. Excellent SBAR presentation, ladies. Angie, you guys have done so much in the last, what, 6 or 7, 8 months. It's incredible. And Denise, appreciate your systematic way of identifying how to start with a hospital in particular areas of a hospital and spread to others. And Kathy, phenomenal job being able to not only sustain, but TeamSTEPPS through COVID, but show that it really helped lead you through it in a really positive way. So I'm gonna stop sharing my screen so I can see everyone's beautiful faces, and just gonna rapid fire some questions that have come in through the chat. Feel free to continue asking questions. But I'm gonna start, some of you touched on this, but what method or what approaches did you take to gain physician participation? Denise, I know you mentioned for those physicians that were not employed by the hospital and some of the chairs, you would go to them. Yes. So it's meeting people where they're at, but how, feel free for others to chime in, but how did you get them to not only buy into it and sit through a training, but how did you get them to really own the TeamSTEPPS tools?
Well, I think it started, we were very lucky at our corporate level. Our CEO, Michael Dowling, really decided when he made the decision that we were going to do this. He said, we're going to do it for everyone. Everyone who walks through our doors and sees patients is going to be involved. He sent out a letter, all right, to all of the staff, including the physicians, both the employed physicians and attending physicians, to say that this is coming. This is how we're going to practice. And at the very least, you need to know what we're talking about. And so you need to attend some sort of training. And then we made a decision, let's meet them where they're at. Let's, let's be honest. Voluntary physicians have to be in their offices practicing. That's what they do. They can't take time off to suddenly come for a 4-hour training. So we went to them. And when we started, and we did this at every hospital, we had a physician champion that was identified by the executive team. And once you have that person, it's phenomenal, because they are the ones who will help you get those physicians on board. I will be honest to you and tell you, with the attendings, we did a abbreviated version. We just gave them the highlights. And our physician champion recommended we feed them. So we did dinners, we did lunches, and then we went to their existing meetings. They were already coming in for this. And one of our sites, we actually took over grand rounds 3 months in a row until we completed all of the tools.
Excellent. Angie, Kathy, anything to add, or any different experiences?
Yeah, I would just add on, those are some of the strategies that we also deployed early on. I think role modeling the way. So at Inova Health System, we have a very large employed medical staff base. And so it is a requirement for them to become trained as part of their onboarding. But role modeling the way, and peer-to-peer support and acknowledgement has been really, really helpful to us. So I think the more we can engage physician leaders to understand the why and to see the results in terms of safety culture results, patient outcomes, and the power of speaking up, that's really important. The other thing is, we just acknowledge anyone who speaks up and creates a psychologically safe space for team members to call out a safety concern. And so when physicians do that, we really like to give them a lot of accolades, because that makes a difference in terms of spreading across that group.
Yeah, I think we had similar things. We were able to pay them, which was unique because of the grant that we had, which I can explain a little bit more around. But even with this second round that we're rolling out, we had the chairperson of OB and ICU go through the master training. And the fact that they were doing that and in there presenting alongside nursing really made a difference. We asked that they attend at the same time with all of our staff in OB. And I think because we had kind of started setting the stage for that up until the point that we rolled this out, and everybody had the same vested interest in improving teamwork. We went to their department meetings, asked, do you want us to come separate? Do you want to do it together? We would really appreciate it if you'd be there. And they decided as a department that they would hold each other accountable to this, and that they all would go through the training with the staff. So that was really wonderful. We're just diving in right now with the intensive care unit. It's part of their education day for the nursing staff, and we're inviting the ancillary teams and the physicians to join just for the hour of TeamSTEPPS to participate in that. And it's been helpful. It's been working so far, but we have a few more to go.
And you touched on it, Angie, and the people want to know how you got your grant, or a little bit of background. Or that's outside my area of expertise, but any comments you could make?
The grant was actually, we are self-insured here at Northwestern Medicine. So that means our provider for liability insurance for our professionals and general liability is through a self-insured company. And this company came forward and said, we would like to do patient safety improvement grants for the hospital, which of course is so smart of them, because if we can improve our outcomes, it benefits them. And so this has been in place for a couple of years. We didn't know about it, and somebody mentioned it as we were trying to roll this out. And so we applied for it, and we were granted $50,000. So I would say go back and even ask your own risk management or legal department if your insurer has any kind of grants that you could tap into, because that was really helpful for us. I think by establishing the positive things that we've seen since that. Now we have a little bit more buy-in to roll out TeamSTEPPS in other areas and support it budget-wise. So
great. And great tip to reach out to risk management and legal. They're great partners to have really early on in TeamSTEPPS. So good shout out there. You all touched on this, but we talked about how to foster different or how to foster ownership across different levels in the organization. But really, how do you build accountability, right? You can train people, they can be super into it. They can say, I'm going to go back and do this. But if you don't hold people accountable, that's where you can really start to fall apart a little bit. So any strategies there on holding people accountable?
We've created checklists for the checklist. So we have people auditing the brief, huddle, and debrief. Not obvious, but they're auditing, and then they're providing feedback real time, or they submit it and aggregate that data and share it. So this percent of the time we did it, 50% of the brief, or we did the whole thing and all that. So I think, just like anything else, you have to keep your eye on it. You have to continue to audit it and have a plan, remove barriers. I would think, it's not going to be, we teach and they do. We have to identify what gets in the way of them doing that and then fix that for them so that it's easier.
I
might add on, Jen, that also building it into when you're looking at your safety events. So you're looking at any of your improvement work. How do you weave this in, or how do you identify where maybe we've missed the mark and we have still some work to do? So I think weaving it into, especially your safety event reviews, and identifying where's the opportunity around some of the TeamSTEPPS tools and safety behaviors is a good way to identify we've still got work to do and build that accountability. The other thing is just, we hold people accountable for registering for their onboarding. It's an expectation to complete that 90-minute virtual class that we have. So we're setting them up at the start of their career at Inova with the expectation.
And I have to say, here at Northwell, there are two things. First of all, coaching, right? If you can send people to 1 million classes, but if there's not some way in the moment, in their practice, all right, that you're holding them accountable, and we do that through our coaches. The other way we do it is our permanent change team, the Collaborative Care Council. TeamSTEPPS is on the agenda for every single Collaborative Care Council throughout our health system. So every month when they meet, they talk about TeamSTEPPS. How is it going? Are we having a problem? Is there a tool that's kind of fallen off? They also do like tool of the month, just kind of like as a reminder, not constant ongoing reminder. And by doing that over and over again, year after year, always having a way to keep your eye on it. Also integrating, as Kathy said, any new employee is trained in TeamSTEPPS. We've integrated into everything that we do, so that it's just really a part of the way we do things, and that also helps to build the ownership, I believe.
Yeah, great point. And I think we can end on that comment. I really want to thank the three of you for just providing such wonderful, concrete, practical information, so that hopefully no matter where our teams are at in their implementation journey, that they're getting something out of this webinar today. So I really want to thank you for your time. I just wanted to close with a few reminders. Following this webinar, everyone's going to receive a pop-up browser on their web or on their screen. So that's our evaluation form. So please fill it out. We really value your feedback. And then again, to claim continuing education credit, Kara has chatted this in, but to claim that credit, you're going to want to text the code to the number you see there within the next 24 hours. If you did not get your question answered and it's still a burning question, feel free to email us. It's teamtraining@aha.org. If you have the question and the panelists that it's directed towards, we can touch base with them and get that answer to you. And again, if anyone needs anything, please feel free to reach out. we love to share. So again, thank you all for being here, and I hope everyone has a great rest of your afternoon.